Senator Millett, Representative Cornfield, and members of the Education and Cultural Affairs Committee. My name is Becky Grant Whedon. I live in Wilton. My dad is from Fort Fairfield, so you've got a Fort Fairfield connection there. I am in support of LD987, and I oppose LD798. I've worked as a public health professional in Maine for 25 years. My expertise is in public health program development. I have successfully secured millions in federal, state, and local grants for my local hospital network, including a $1.7 million federal grant, the bulk of which benefited our local school. In the 90s, I co-wrote the white paper used by the Maine State Legislature that served as the foundation for the state's tobacco-free Maine program. The cornerstone of a solid, effective public health program is a well-developed problem or need statement, which readily provides an obvious goal. This requires a thorough exploration of the data available without sensationalized cherry picking. Here is the non-need statement for removal of non-medical exemptions. In Maine and in the U.S., overall vaccination rates have never been higher in our history. The general trend is upward. While there may be years where certain vaccine rates drop momentarily, the rates as a whole in the state and nation are on a fully upward trajectory. Maine's kindergarten vaccination rates have gone up consistently since 2000, when the rates were below 90%. Rates have been rising steadily over the past 2 decades and are now at 95%. Our first grade and 7th grade vaccination rates are even higher, at 96.5 and 97% respectively. Maine's school vaccination rates have been at or above the national average for the past 3 years. Maine's overall toddler vaccination rates are also above the national average. In fact, Maine's toddler vaccination rates are in most measures higher than the 3 states that do not even allow non-medical exemptions. We exceed all California toddler and teen vaccination rates. If you look at data not tied to school enrollment, vaccination rates in toddlers in California actually dropped across the board with the exception of the MMR rate. Maine does not have a high vaccine exemption rate. Simply put, it is mathematically impossible to have a vaccination rate higher than the national average and claim that we also have the 7th highest exemption rate. Maine's rate is 95%. Our exemption rate is 5%. The U.S. vaccination rate is also 95%, yet the national exemption rate is 2%. Someone's math does not add up. What this tells me is Maine school nurses do an excellent job at turning in vaccination records and exemptions, and other states have gaps. LD798 is a solution without a problem. It is a grab at the low-hanging fruit that looks like a public health win, but will likely do very little to change overall vaccination rates, and based on California data, may result in unintended consequences of vaccine refusal or delay in the toddler population. I encourage you to all go online yourselves and look at the data at the CDC tool Child VaxView, where all of this came from. You can look it up. And I'm done.
Thank you very much. Are there any questions?
And I was under time, yay.
Representative Drinkwater.
Thank you for your chart that you gave us, the Maine kindergarten immunization rates. How current is this one?
That is up to, I think it's 2017-18. So not this past year. So.
Thank you for bringing that.
And that's all from the current year, yes, thank you.
Thank you for bringing that.
Yep.
Senator Pouliot.
This last page of your testimony from the Johns Hopkins Hospital patient information sheet talks about care at home for immunocompromised patients. And it says, can I have visitors? And it says, tell friends and family who are sick or have recently had a live vaccine not to visit. So, I mean, is this suggesting that people who have been vaccinated could compromise an immunocompromised patient?
Yes, but it gets to what Danielle Grondin mentioned previously in her testimony.
So having people that are recently vaccinated could actually negatively impact an immunocompromised patient?
Yes, with
That's
a live
tongue
virus
twister, by the
vaccine
way.
only. Yeah.
Okay, thanks.